Hey guys, welcome back to my channel. I know this is a whole new setup and background and the lighting might be a little different. I'm using natural lighting because I'm using my vlogging camera right now, just because I wanted this a little bit more personal. So yeah, that's why. We're just in my living room by my Christmas tree that my children decorated all by themselves, and they did a great job. And my coffee because I'm tired. Yeah, so basically this is just gonna be like a life update video, kind of a chit chat video on my surgery. Today is December 1st or December 2nd. I don't even know what day it is. It's December 2nd. So I'm going to be getting orthonatic. I can never say it. It's orthonatic or orthonatic. It's weird. There's like this weird little thing in there. You have to but anyway, it's like orthonatic jaw surgery, and I'm getting that December 9th, so exactly 1 week from today. But you'll be seeing this video probably the Wednesday before surgery. I have been pre-filming a lot to try to get me out at least 6 to 8 weeks with videos, because I'm not sure how long my recovery is going to be. It's usually 6 weeks, but I, as a surgical candidate, am a little bit older than the usual person getting the surgery done, so it may take me longer, as well as I am a type 1 diabetic, so we tend to not heal as quickly as other people, even though in the past I haven't had any trouble healing with anything. So fingers crossed that that continues. Oh, the sun came out, yay, lighting just got better. And there it goes. I lied. But anyway, I guess a little background for the surgery and what it is and why I'm getting it. When I was very young, I want to say 4 or 5, I can't remember, I have to ask my mom. I was at a daycare and I was playing on the monkey bars, and I was at the top, and I guess I had slipped and fell and hit my face and knocked all my front teeth out and jammed my jaw joint. So we didn't have insurance then, we didn't have a lot of money, so the daycare provider paid for the medical expenses. Basically, they had to pull out all my front teeth, like from here to here. All these got ripped out. They're already broken and snaggletooth because I hit my whole face. So it was pretty traumatizing as a 5-year-old child to have that happen. And they said there wouldn't be any long-term permanent damage to my jaw. However, that wasn't true. As when you're 5 years old, your bones are still growing, you're still growing, things are still forming. So me having such a traumatic injury to my face caused my lower jawbone here to stop growing. It didn't grow as quickly as it should, and it kind of just stunted the growth of it. So I have a hair on my face and my dog's pacing. So it wasn't too bad, you know, when I was younger, but the older I got, it's like it didn't fully grow. So and I have a lot of popping and lockjaw and joint pain, and just a lot of, like, it almost feels like Charlie horses in my, like, muscles in my face. And it's basically because my jaw muscles have to work harder to move everything, and it's not aligned correctly. So it's like it kind of sets everything off. So I get really bad migraines, and now they discovered that like 50% of my airway is closed because of it. And as I get older, the bone is degrading even more and pushing my lower jaw back even more than it was. So they basically said, you need to get surgery now. I was supposed to get it when I was like 16, and I threw a fit because I was terrified of surgery. I'm still terrified of surgery. I'm still, like, I'm really scared to go through this right now. So I just begged my parents not to do it. I said, I'm fine with the way I look. I don't care. Like, it's not bothering me that bad. I don't want this surgery. So I put it off and put it off and put it off. And it always bothered me because I looked a little different. My profile was a little different. My, you know, face shape was a little different. And I did get teased quite a bit in middle school, high school. Even now, people, you know, like to say ignorant things. And for a while, I just told myself, that's fine. If that's the only thing they can say bad about me, then whatever, I can deal with that, because, you know, people pick apart supermodels and say they're ugly. So if my chin is the only thing they make fun of, then let them feel better about themselves by trying to tear someone else down. And I kept telling myself that, but I'm not gonna lie, when people said it, it hurt, and it affected me, and it affected my self-confidence, and just never feeling pretty, or, you know, like, oh, I used to tell my mom when I was little, I'm never gonna get a husband, nobody's ever gonna love me, and stupid things like that. But I actually am married, and I have a wonderful husband who I'm very grateful for, and he is going to be taking care of me. So I'm really glad that I have someone that's, you know, cares about me enough to take off work like he's taking off work, which, you know, a husband would. But he's just really excited to take care of me. I don't know how excited I am, because I'm pretty sure I'm not going to be very nice, because I'm going to be in a lot of pain. So everybody say a prayer for him. But anyway, that's kind of the backstory of what happened to me. So my jaw growth was stunted due to a childhood accident. So about 2 years ago, I decided, okay, I'm done with the pain. It's really starting to bother me. I'm having horrible, horrible migraines, to the point where it was like I couldn't function. I would be laying in bed and they would just hurt and cause a lot of tension. You know, I was having a lot of problems digesting because I couldn't chew my food properly. I don't know what it's like to fully like take a bite out of a sandwich, because I have a severe overbite. So I don't know what it's like to bite into a piece of pizza. I always bite kind of to the side, or I have to force my jaw forward to bite. And I went to the doctor because I was having a lot of pain. I was like, okay, well, maybe it's just like TMJ or something. And they did a bunch of x-rays and looked into a bunch of things, and they basically said, yeah, your bone's degrading on the right side of your face, and you're missing a part of your jawbone. It's gone. And if you don't get the surgery, then your jawbone is just going to be like, meh. And like, I was like, great, my jawbone's going to fall off. What else, God? What else? So I went to a specialist in Wilmington, Delaware. I live in Maryland. I live in northern Maryland. So I did a lot of research, and the best of the best that I found in this area was him, and it's Dr. Daniel Mira. He'll be doing my surgery. I love him. He takes time to sit and talk to me and really go over things. So if you're getting this surgery and you need a surgeon, I really highly suggest him. So exactly what is the surgery? The surgery is basically, and I'm not sure, they think that they're gonna have to do upper jaw and lower jaw, just because they can only pull the lower jaw so much forward before it's just not gonna go forward anymore. And then they'll give me an underbite. So to make me look, I guess, proportionate, and to really effectively correct my bite, they might have to do my upper jaw. And like a dummy, I decided today, before making this video, let me YouTube what that surgery looks like, and it's pretty gruesome. I will leave the links down below. I'm just letting you know, it is gruesome. If you don't like blood and things hanging, and it traumatized me. I basically started crying, and I was like, I don't want to do this. I don't want to do this anymore. I changed my mind. I don't care about the pain. I don't care about people thinking I look ugly. I don't care anymore. And I'm kind of feeling like that now. It terrified me. I'm really, really scared. It's given me a lot of anxiety over the past few months, but the moment that we set the surgery date, my anxiety just went high up. I can't sleep at night. I'm losing my appetite. I'm feeling sick to my stomach. I'm feeling nauseous when I think about it. And I don't know why I got it in my head to watch the freaking video, but I did, and that pretty much traumatized me, and I don't want to do it anymore. But there's no turning back now. It's a little late for that. So anyway, I know this is kind of like everywhere. I'm really sorry. My brain is just like, I have like ADD, so my brain just goes here and here and here and here and here like it's doing now. So I'm gonna stop, reel it back in. So anyway, I went to a specialist, and I was like, okay, well, break my jaw, I'll do the surgery. And they're like, no, 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 no. It doesn't work like that. It's a long process. It's a journey. And basically, you're going to have to get braces. And I was like, wait, what? What? Oh, and by the way, they're not covered by most insurances. And I was like, wonderful, awesome, great. So I have to pay for braces that I need to get the surgery that I medically need, but they won't cover them because it's, you know, cosmetic. But I'm like, that doesn't make sense. I have to get the braces to get the medically necessary surgery, but they're not covered. So I argued about that. Insurance company was like, no. So I ended up having to pay for them. And then I was thinking, like, God, I already don't feel attractive. I already don't feel pretty. And now I have to get braces. Like, I'm going to hate my life. So I got over that pretty quick. It was like, get over yourself. There's more to life than how you look. And I went and got the braces. They hurt. And I don't wish that pain upon anybody. They did a very aggressive treatment on me to try to get me ready for surgery as quickly as possible. So I'm sure other people won't go for tightenings and stuff as much as I did. I don't know if it just hurt more because I'm an adult and everything's kind of set in place. But yeah, you pretty much need braces prior to getting the surgery because one, they need to correct your bite and teeth as much as possible using orthodontics prior to surgery, so once they move everything, they know exactly where it's going to be. And two, they actually use the braces to wire your jaw shut afterwards. And like I said before, the lower jaw, basically they cut all right here into the bone and cut back there, so it actually, your jaw is just kind of floating there. It's not attached to anything. So they take like a drill and drill down like this and then down here on both sides, and then they kind of chisel it till it cracks. I know it's, ugh. I don't know why I watched the video. And then it exposes a nerve, which they basically said don't hit the nerve, and I'm really hoping they don't hit the nerve because I will lose all feeling here, which I don't want to do. So yeah, so then it's movable, and they basically pull it up and move it into place. And then they take these, like, I guess pins and bolts that look like a little dog bone, and they, I guess plates is the better term, and then they just screw them into place here. And then if they do the upper, then they literally cut your entire upper jaw out, and it's just hanging there. Well, it's not even hanging there. It ain't attached to nothing. It's just floating in your mouth, which really grosses me out. So I'm really praying to God that they're not going to do the upper, and I won't find out until Monday if they're doing the upper and lower. So pray that it's just upper for me, like really pray for me because I'm scared. But then they bolt those into place as well. Then you get basically what's called splints, and they're kind of like a mold or impression of your teeth, and they lay it over your teeth to keep your teeth in place so your muscles don't try to pull the jaw back or forward or whatever way they're moving it, and then they wire everything shut. So all my cuts and everything will be on the inside of my mouth, so I won't have any visible scars unless, like, because I have really tight lips, as they say, like I don't have a big mouth. So if not, they may have to make a little incision here, but it's really tiny. And yeah, that's pretty much the surgery. And then I will be on a liquid only diet for a few weeks, and I think I can eat like baby food type-esque stuff, like bananas and mashed potatoes, baby food, that kind of thing. Maybe 3 weeks out, 4 weeks out, but I think I won't be able to eat like steak or nothing for a really long time, which sucks because I love steak. But yeah, that's pretty much that. The recovery, like I said earlier, for most people is 6 weeks long. For me, it may be a little longer. After the surgery, you do have to stay in the hospital for a day or two. But again, me being a type 1 diabetic, I may have to go into ICU and be on an insulin drip. And being on an insulin drip, that instantly puts you in an intensive care unit because it's such a high risk drug. So until my blood sugar stabilize and pain management is well and I can tolerate keeping liquids down, then I'll be able to go home. Which I hope I'm well enough to go home the next day, because I don't want my kids to be worried, like, where's mommy? And my mom's gonna be here, and I really, you know, I don't care how old you get, when you're not feeling good, you want your mommy. So I want my mommy, and I hate hospitals. I've been in and out of hospitals since I was 8 years old with, you know, diabetes. And then I had mentioned before in a kind of get to know me video, I took it down because I didn't like the lighting. It was horrible. But if you did watch that video, I did briefly talk about at age 19, I did go blind in both my eyes and had to get a bunch of surgeries and was told I'd never see again. So I don't like surgery. I was freaking out at those surgeries and I was only 19 years old. And now I'm 32 and I still freak out over surgeries. And I don't know if it's like this subconscious thing about hospitals and surgeries and doctors I have from being like a little kid with a chronic illness type thing. So I don't know, but I'm psychologically, I'm not dealing with it well. I'm very, very scared and it's definitely affecting me. That was my phone. But I'm trying to be positive and just trusting God that he's not gonna like have me die, because I have 2 little kids I still need to take care of and that they still need me. But I have this intense fear, and I don't know where it's coming from, that I'm going to die during the surgery. And it sounds stupid. People get surgery every day. Thousands of people get surgeries every day and they come out fine. But I have this ridiculous fear of dying in surgery. And I know everybody has like fear of spiders and fear of driving over bridges and whatever. Mine is fear of going under anesthesia, which is crazy because I used to do anesthesia for years in veterinary medicine, not human medicine. And I know how it works and all that, but just, maybe it's just a control thing. Like, I don't like being not in control of myself. And I guess the fear is like when they tell you to count to 10 or they start talking to you and then you go to sleep, like, what if that's the last time I'm awake? What if I die and that's the last thing I say and the last thing I see, and then my kids aren't going to see me, and who's going to tell my kids that I'm dead, and I won't be there for my daughter's wedding, or my son has his first child. And I know these are like irrational fears, but these are my fears and I just wish there was a way to overcome them. And I am a Christian, I am a believer, and I have been praying a lot that like God just takes the fear from me and gives me peace. And you know, my mom's been praying for me and my friends have been praying for me, and I know that he's in control ultimately. And I know God does not give you a spirit of fear, but of a sound mind. So I got to keep telling myself that this is not from God. This is an irrational fear. And I need to stop being so afraid. And people, you know, go through much worse than me and make it out. So I need to stop being a baby. But so my camera overheated and cut me off. And now it's been a while, so I kind of forgot what I was talking about. But yeah, I'm, like I said earlier, I did pre-film a bunch of videos, so hopefully I won't be away from YouTube too long, and hopefully I recover quickly. My Christmas is pretty much shot because I'll only be like 12 days, I think, or something like that post-op. So I will probably be heavily drugged and not feeling well. And I kind of feel guilty because I kind of feel like I'm ruining my kids' Christmas. But it just kind of sucks because I haven't done all my shopping. I try to, you know, I try to get the house in order for my mom coming so everything's easy to find. You know, it's just, this is really affecting not just me, but like my whole family is pretty much having to come to my aid and help, which is awesome that I have a family that is willing to do that. And I'm blessed to have the family I have. And you know, I'm definitely thankful for them because I know a lot of people don't have that. And I just feel bad that they have to do all that. But I guess that's what family does. And I have a great family. My mom is my best friend, my rock, my everything. So I'm really thankful she's able to come. My family lives back home where me and my husband are from in Southern Maryland, St. Mary's County. I don't know if you guys even know where that is, but we're in Northern Maryland, close to like the Delaware and Pennsylvania line. Hence why I'm going to the doctor in Wilmington, Delaware. But yeah, I just kind of wanted to update you guys on where I'm going to be, and if my videos seem a little off or whatever, it's because I have been pre-filming. I'm going to be doing about 1 video a week every Wednesday. I'm going to try to go ahead and get those up. So if I'm not answering any comments or responding, it's because I'm heavily doped up. So as soon as I can respond and talk to you guys again, I definitely will. I'm gonna have my husband try and vlog the entire experience of surgery day and a few days after. So I'll probably scare you guys with no eyebrows on, so I'm gonna apologize now because I'm sorry. It's bad. But anyway, I'm gonna have him try to vlog. I'm gonna try to get on Snapchat, so if you want to follow me there to kind of get an everyday update thing, I obviously won't be talking on Snapchat, but I will try to take like daily progress pictures, and so you can kind of keep up with me. And yeah, so I hope that I'll be back soon and I'll have a completely different face, which I'm also a little bit nervous about too. Like, am I gonna look completely different? Am I not gonna recognize myself? Is, you know, like my family not gonna recognize me, or my kids not gonna recognize me? It's kind of weird. Like, it's the same face I've been staring at for 32 years and now it's about to change. So I'm a little nervous about that. Like, what if I hate the way I look afterwards and it, you know, and I regret the surgery, or I have like permanent damage to my face and I'm, you know, disfigured for the rest of my life, which kind of defeats the purpose of getting the surgery. So I just have a lot of worries and fears. I am an overthinker. I overthink everything. I think of every possibility of what could possibly happen, to the point it drives me insane, and everybody is yelling at me to stop looking up YouTube videos and stop worrying about it, and I'll be fine and everything's gonna be okay, and this time next year it's gonna be all over with and worth it, which I can't wait to get these braces off. I want these braces off so bad. Like, you don't even know. I hate them. I hate them. But thankfully, the retainers I'm gonna wear after I get the braces off are like the clear Invisalign retainers. So I'm thankful for that I won't have metal in my mouth anymore. And they're saying that after surgery, braces have to stay in for like 6 to freaking 10 months. And I was like, look, doc, I'm supposed to be going to Key West in July, so this whole 10 months thing isn't gonna work for me. I need the 6 months. Like, I want to smile in pictures without this. Like, this is not cute. I don't like it. But I just have really little teeth, so I feel like the braces take up all my teeth, because my friend Carolina has braces and she looks so freaking cute with them. Like, I love how she looks with braces. She's like adorable and they look cute on her. And me, I look like the typical metal mouth, like metal mouth, not cute. So I just want them out. And also I got acrylic on the top. I don't know if I mentioned that in like previous videos, because I've actually never done, I'm sitting on my pants and they have zippers on the thing and it's hurting. Ow. Ah. But I've never actually done like a video dedicated just to my braces and surgery. So they're kind of like filtrated in with all my other videos. So I did get acrylic on the top, which is the clear. I don't know if you can see them. It's like the clear ones. I don't recommend them. They cost me like $600 and some more. And they actually take longer to fix your teeth, I think by like a month or two. But the main reason is they have to put like a clear band on them and they stain really bad. So even if your teeth aren't stained, they get stained, so it makes your teeth look stained. And I absolutely hate it. Like, I don't recommend the clear ones. Just get the silver ones and get it over with and all that. But anyway, like I said, this will be going up the Wednesday before surgery, so I will have a day to answer any questions. So if you do have any questions for me about it, like I said, I know this was pretty rambly and all over the place. I wasn't really sure what I was gonna say and talk about in this video, so I'm sorry. But if you have any questions for me, definitely let me know. If you're getting this surgery, we can definitely talk about how you feel when your surgery is, all that. Impressions suck when you get your surgical impressions done and they go to pull them out. It feels like they're ripping all your braces off, so that sucks. Just want to prepare you for that. And the CAT scan's super easy if you're going for one of those. That's probably the easiest thing to do. And yeah, so I guess thank you guys for watching. Again, say a couple prayers for me because I am terrified. And I just want you guys to know that I love you, and I have been on YouTube for a year now, and just the awesome people that I've met so far, and my loyal subscribers that are always commenting and always saying kind things. You know who you are. I really appreciate it. I know some of you guys by name now, and I really appreciate and love you guys, and kind of feel like we're a little family. So thank you guys for sticking around with me for an entire year, and I love you, and I'll be back as soon as I can. So until next time, I'll see you later.